Becoming a competent patient means something different for everyone, especially as each person's healthcare journey is unique. When it comes to surgical procedures, there's a heightened sense of concern and added layers of medical care, all of which may affect a patient's confidence. So when you find a surgeon who is both highly qualified in his profession and is recognized for his approach by the patients he treats, you bring him to learn his secrets. Thank you for joining us on The Confident Patient in a New World. I'm Beth Myers, founder of 2x2 Health and co-author of The Confident Patient. Of course, with me today is my co-author and co-host, Wendy Benson. Joining us today is Dr. Kern Singh, endoscopic spine surgeon at Rush University Medical Center. Dr. Singh has an international reputation for his work in minimally invasive spinal surgery. He is one of the few surgeons in the United States performing endoscopic spine surgery. His award-winning research has been published in major medical journals and very relevant to this conversation. Dr. Singh was awarded the Top 10 Doctor Award, Most Compassionate Doctor, and Patient's Choice Award from Vitals.com. Wendy, I'll let you take it from here.
Dr. Singh, we are so pleased to have you join us today. Thank you for being here.
My pleasure. Thank you for having me.
So, it's such an important distinction that there are just so few surgeons out there that do minimally invasive spinal surgery. Can you just tell us a little bit more about that and what that means for our patients?
Sure. I think that oftentimes minimally invasive gets kind of thrown around for just marketing purposes. But for those surgeons who actually do it, it's kind of like I tell patients nowadays, you see an athlete gets an ACL tear, they never open up the knee, they do it arthroscopically. Those patients who have their gallbladders removed, now they do it laparoscopically. And that evolution is occurring in spine, and that's the minimally invasive approach. So small incisions, fast recovery, the vast majority of these procedures done as an outpatient in the surgery center. So those long hospitalizations are kind of eliminated for the most of patients who are affected with spinal disorders.
It's great to hear.
It's so interesting, and to be able to have a shorter recovery time is just so important. When people are going through the process of realizing that they need spinal surgery, a big part of that is choosing their surgeon who will be doing that. How do you help direct people when they're trying to decide who's the right surgeon for them?
Well, I think that's the hardest thing. I mean, I've been on both sides. My brother had to have brain surgery when he was in medical school, and I saw kind of the challenge of trying to figure out who's a good surgeon, and that's coming from someone who's in healthcare. I think oftentimes talking to other friends or colleagues who've had spine surgery or who've had surgery and getting their input, not only just from their outcome, but how was the surgeon, how was their team, were they responsive? Did they call back in a timely fashion? Did you feel like they were engaging? And I think in particular for spine surgery, go meet 2 or 3 spine surgeons, get several different opinions, and then kind of feel what's right after you do your homework online.
I agree. And I tell that to a lot of our patients, go with someone that you feel like you can really connect to and feel comfortable asking questions with. And also someone that has a great team, someone that is going to get back to you and answer your questions in a timely manner.
Yeah, my team I agree with that completely. I mean, my team, they handle the brunt of most of the patient questions or concerns or anxieties. And we have a policy, and it goes back to, like I said, when my brother was needing medical care, which is, what would I want for a family member? And can we have a rule in place, which is everyone gets an email back or a phone call back that same day. So within 12 hours, whether that's even scheduling appointments on a weekend or a holiday or during the day. So I think that now, patients should expect that. And I think that, the patient should just feel that the team and the surgeon are a kind of a good fit, not just the surgeon themselves.
Absolutely.
And that responsiveness rate is so important. Just knowing that if I do have a question, if I do have a concern, that someone is going to be getting back to me from your team. I mean, that's really reassuring as a potential patient, definitely. That could really sway someone's decision as to where they go for care.
Yeah, I think that, so most of my practice, I would say almost 90% of my practice at this point is just word of mouth, someone I've operated on or a family member or a friend, et cetera. And almost all uniformly say that one of the intangibles or the experience that they had with my practice was, it was a Friday night, they had some discomfort, maybe post-surgically or before their surgery. They are anxious, they're going to go to the emergency room, And a simple email and a phone call back on a Friday night saved them a whole night, of pain for being in the emergency room for 12 hours. And so those little things of just even anxiety before surgery or questions immediately following surgery, all those things, I think that, nowadays we're so digitally savvy that a simple email, a follow-up text message or whatever, I think gives a lot of reassurance to patients. And I think it goes a long way.
Yeah,
absolutely. So when someone has determined who their surgeon is going to be, what advice do you give for patients and their family members to prepare in advance of the surgery?
I think the most important thing is to understand what the recovery will be afterwards and expectations. So, I think that at least in my practice, we changed how we approach the patient education, the preoperative experience. And, all the studies that came out of the total joints, the total hip and total knee literature showed that preoperative education was the most important. And they do a standardized kind of teaching class before surgery. So I actually kind of mimic that and follow that. So I think actually the best thing to prepare for post-surgery is to prepare before surgery. And I tell every single patient when I tell them they need surgery that they go home and think about it, and then to come back with a loved one or a family member or family members, because that way they can take notes. There's a high level of anxiety and stress. I think hearing 2 or 3 different, viewpoints on the same conversation can help ease some of the anxiety afterwards. And then afterwards, I think the most important thing is to make sure you understand what the expectation for recovery is. So if it's going to be a day surgery, then make sure you have a caregiver or a loved one around for you for that night, not to rush things back. You can always go back to work earlier, but take the time off that you need that kind of seems appropriate for the procedure you have. And that kind of helps to alleviate some of the anxiety with, oh my God, I'm still in discomfort. I've got work, I've got family issues. I think preparing beforehand is so essential to improving the outcome afterwards.
Absolutely. And one thing that you told one of our patients before, and I say it all the time, I say, I worked with a surgeon before, and he said, recovery is kind of like a saw. Like you're going to have a good day and you're going to have a bad day, and you're going to have a good day. And then you might get a little more good days, and then you're going to have a bad day. And I think people really need to remember that. And I think bringing someone to your appointment, the confident patient, we kept screaming, bring someone with you. And then COVID hit and nobody could go with. But I think most doctors' offices now are back to having people, which has been really helpful for our patients to know that there's someone by their side.
Yeah, we're allowing people back in the office. And even if they don't, I have them FaceTime their significant other or loved one. So, I think that especially for bigger surgeries or older patients, I think having the entire family, that is maybe their significant other, their daughter, their son, whatever it may be, all on the same page and understanding kind of the expectations. It's shown over and over again, and we published several papers on this, that expectations, if you understand expectations preoperatively, the satisfaction for patients postoperatively goes up dramatically. So I think you tell someone they're going to be up and walking in 2 hours, you tell them they're going to be taking medications for maybe 72 hours, and they understand that game plan, and they can kind of, recite that back to you. And I think they're much better prepared postoperatively, and that level of anxiety goes down dramatically.
Yeah. I think that's so powerful, both for the patient going through that and for his or her loved ones to really understand what to expect. And that really does change the level of apprehension. I think that's fantastic advice. So you've been recognized in so many different ways, Dr. Singh, several awards. And when Beth and I co-wrote The Confident Patient, what we really wanted is for people to feel educated, empowered, and you do this through your work every day. You've been awarded a top 10 doctor award, most compassionate doctor, Patient's Choice Award for Vitals. These awards speak to more than just your skill and talent as a surgeon. Can you share with us the compassionate side? What do you and your team do for patients that's brought you all these incredible accolades?
I'm going to be the first to admit I'm not the most compassionate. I think that part of it is, it kind of goes with the surgeons that's very decisive. And, I think what I do is I know my strengths and I know my weaknesses, and I surround myself with people who are very talented. So my physician assistants, my administrators, they're all phenomenally nice people. They're very engaging. And I think the team helps complement my kind of patient interaction style. And my patient interaction style is very, I guess, concise, maybe I wouldn't say blunt, but to the point. And I really, truly believe I only make a recommendation for patients for surgery if I would do it on myself or my father, mother, brother, sister. And I spend most of my day telling patients they don't need spine surgery. And that's probably where I ended up with this Compassion Award or the Vitals top 10 doctor, because, people came to me, if I see 50 people in a day, no joke, I tell 30 patients they don't need surgery. And those same patients have been told by 2 or 3 spine surgeons they need surgery. So some of the greatest testimonials I have are from patients who got dramatically better with physical therapy, with medication, with whatever it is, and that I prevented from having surgery. They're probably some of the happiest patients I've ever dealt with. And I think they appreciate the team effort. And it takes more time on my staff and myself to talk somebody out of surgery. By the time they come and see me, it's kind of a selection bias. They're ready for surgery. And here I am changing their whole kind of view on the world. And I think that's probably where my team excels. I think that we spend a lot of time getting the right treatment for the right patient. And I think they're appreciative, whether that be surgical or non-surgical.
Yeah, that's incredible. Yeah. So when you think back over the last year and a half, there's been lots of changes, obviously, for all of us in the healthcare community and beyond. How have you helped patients feel and stay more confident about their healthcare?
So I think that, it's interesting because spine surgery has, it's filtering through a lot of patients and kind of figuring out other issues. So spine surgery has complexities of patients who may be suffering from anxiety, depression, loneliness, and that leads into chronic low back pain or chronic spinal conditions. And so, I think COVID really amped that up. People felt isolated, people felt alone, become depressed, and then they start focusing. They may have some problem with their back, but it becomes amplified, just like stress and hypertension or high blood pressure can have that happen. So I think, as we slowed down, which was just inevitable with COVID, the few patients that we saw, we spent more time with. And that was, I think, therapeutic in of itself. So whether that was the anxiety of doing surgery in a time where they weren't sure about their job, or whether that was just treating the anxiety from being alone, I think we were able to make a difference just based upon the time we were able to allocate per patient. And I think the other thing that was really dramatic is we became much more adept, facile at telemedicine, make it more engaging. Actually, some of my best visits are telemedicine visits. People are much more relaxed. They're in their own home. They don't have the anxiety of sitting in a doctor's office for an hour. So you really get to find out some of their hobbies, what they do professionally, interesting backgrounds. It becomes, a conversation piece. So I think it's actually not as kind of impersonal as it seems. And in some ways, it can be a little bit more engaging.
That's interesting how many different levels of change this has brought about.
And we really need it in medicine to get to that next step with telemedicine. So it has been really helpful. I'm glad we finally got there. Dr. Singh, it's been a pleasure. Thank you so much for sharing your insights with us. It really resonated with me when you shared how important teamwork is and how patients really feel like they're getting good care when they have a good team. You can learn more about Dr. Singh and his medical team at kern.singh@rushortho.com. Of course, you can find all our episodes of The Confident Patient in a New World on your YouTube channel and our website at 2x2health.com.
Thank you.
And from all of us at 2x2 Health, we wish you great confidence and health. Thank you so much, Dr. Singh.
My pleasure. Thank you for having me.
Thanks. Bye.